Good Saturday morning. Hello, I'm Daryl Russell, and I'm a licensed agent and the Director of Training with Affordable Medicare Supplements, or AMS for short. We're an independent insurance agency, and we try to help you learn Medicare so you can avoid costly mistakes, penalties, as well as help you maximize your Medicare coverage with confidence. If you're new, be sure to click subscribe, and as always, any links to any publications or websites we'll mention during this class, you'll actually find linked in the description box below. So let's go ahead and get started today. And I forgot to mention, as always, in another room here monitoring the broadcast for quality as well as taking questions is Justin, another one of our agents here. Why don't you come in and say hi to everybody, Justin?
Hello, good morning, everyone. Thanks for joining.
Okay. All right. So again, if you're unable to send a chat question through YouTube, just go through email, info@amskc.com, or through our text messaging system, and we'll get those messages relayed during the live broadcast. So our class today is entitled Medicare for the Soon to Retire, all about learning Medicare. And I'm a big believer in reference points. So everything that we do here, I'm actually going to reference where it came from the Medicare and You. This is the official U.S. government guide to Medicare. And we'll sometimes talk about Medicare Supplement programs. And again, this comes from the Choosing a Medigap policy booklet, which is the official U.S. government guide. I know it says 2019. They've not yet brought out the 2020 version of that. So that's why you see that. If you don't have those documents or you'd like others, here's a screenshot of our website. Again, it's just amskc.com. And if you click on the Helpful Resources tab, we have several documents and forms available for you to quick download. So just a quick housekeeping point on that. Okay, so when it comes to Medicare, there are four basic parts of Medicare. There's your Part A, which is your hospital-only coverage, and then there's Part B, which is medical or your doctor's outpatient. And these are the two parts that make up original red, white, and blue Medicare. And these are all managed by CMS, the federal agency that's in charge of the Medicare program. I've put a red line down the middle here because your Part C, which is Medicare Advantage plans, as well as Part D drug coverage, while these are part of Medicare, they're offered by private insurance companies who are under contract to CMS and must follow all of the government's rules. So, to be eligible for Medicare, well, you become eligible for Medicare one of three ways. The first day of the month that you turn 65, whether you retire or not, you're eligible for Medicare. If you are under age 65, if you've been receiving Social Security disability benefits, regardless of your age, you become automatically eligible for Medicare the first day of the 25th month. And thirdly, should you be diagnosed with Lou Gehrig's disease or end-stage renal disease, sometimes called ESRD, then you receive Medicare shortly after those diagnoses. And to be really clear, you must have both Parts A, hospital, and B, medical, to be fully insured under the original Medicare program. And we've got a sample of what a red, white, and blue Medicare card looks like. So let's go ahead and take a closer look at just exactly what is Part A, what do I get, and what does it cost me. Well, Part A, again, is coverage for inpatient hospital. It's sometimes referred to as the brick and mortar portion of Medicare. So if you were hospitalized under original Medicare with Part A, you start with a deductible, which in 2020 is $1,408 a benefit period. And then after your deductible, Medicare has copays, but you can see for the first 60 days, there's $0 copay. So basically the first 60 days, your $1,408 deductible is the only thing that you're really worried about. Should you go longer than 60 days, your copay does rise. It gets significant, $352 each day for the next 30. and then even as high as 704. But I think most people would agree long-term hospital stays are less common in the year 2020. So once you move beyond hospital, you could use Part A for skilled nursing facility care. Now, don't confuse this with long-term nursing home. This is where you've had a stroke, maybe an illness, an injury. You need some physical therapy, speech therapy. You're going to get better and go home. So you're under the constant care of a medical doctor daily. So for the first 20 days, Medicare will cover the first all the charges 100%. From day 21 to 100, for a total of 100 days cumulative, you have a $176 per day copay. Part A also will provide coverage for home health care. This is when you're housebound, can't get out for therapy. It's very limited, but there is no copay to you. And then hospice care for the terminally ill. So that's what you get for your Part A. So what does it cost me? Well, most people who have 40 quarters of Medicare covered employment do not pay their Part A premium when they enroll. This was all payroll deduction taxes while you were working. If you have less than 40 quarters, or 10 years basically, of Medicare covered wages, then there is a premium. Those are listed below. Non-working spouses can claim under a working spouse's earning record, but most people do not pay a premium for their Part A. Okay, so now the Part B, which is your outpatient medical, starts off with an annual deductible of $198. Excuse us. It is a, bless it. Hold on just a moment. I set the phone to do not disturb, but there's one application that it'll come through, and that happened to be the one that did. So, pardon that, folks. It is live. Okay, so your annual deductible, this does change yearly. For the calendar year 2020, it's $198. You meet that once, you're done with it for the year. Most people who enroll in Medicare Part B pay the standard premium of $144.60 a month. And this is adjusted based on income. So if you're single and your income is below $87,000, you pay the standard. For a husband and wife joint tax return, it's $174. This can and does change yearly, and we'll talk about that a little bit later here in the presentation. You pay your Part B premium one of three ways. If you're drawing your Social Security at age 65, it can be deducted through that, but many people are delaying Social Security to a later date. You can send a quarterly check-in to CMS, or you can authorize CMS to take the monthly premium directly out of a bank account. And again, those forms are on that helpful resources page that I mentioned at the beginning of the presentation. Okay. So what do I get for my $144.60? Well, after your $198 deductible, Medicare Part B pays 80% of what they approve, and they leave you as the Medicare member to pay the other 20%. And it's no big secret the doctors bill more than Medicare approves. Anytime a doctor who bills the Medicare program, if they bill more than Medicare approves, they always accept, typically, what Medicare approves. So don't worry about the amount over that. So if you go for a doctor visit, you need some type of outpatient therapy, you're having durable medical equipment, things like wheelchairs, hospital beds, CPAP machines, breathing machines, canes, walkers, that type of thing. Your emergency room falls under Part B. Most of your outpatient services, so that could be a same-day surgery, going in for a CAT scan, MRI, lab works, blood tests, all that type of thing. So Part B is a very critical portion of the Medicare program. And again, Medicare will pay 80% of what they approve. You would pay the other 20%. And typically the amounts over what Medicare approves, no one is responsible for. One issue with Part B, that 20% does not have a cap. So in theory, if you had $100,000 of Medicare approved charges, while they would pay 80%, your 20% would be $20,000 because there is no cap. Okay, so I talked a little bit about the charges. Here's an example. Say you go to a doctor and he bills $250 for a comprehensive visit. Medicare receives the bill, but they only approve $100. Assuming that you've already satisfied your Part B deductible, Medicare would pay 80%, that's $80. The member, you would have the remaining $20, and the amount over Medicare approved charge of $100 is typically written off by the doctor or the lab. This is an example of what's called Medicare assignment. The doctor agrees to bill what Medicare approves as payment in full. Now, there are some things that are not covered by Medicare Part B. That would be long-term care nursing home. If you're looking for dental coverage under Medicare, it pretty much is non-existent. Same thing for dentures. Medicare covers diseases of the eye, so things like cataracts, glaucoma, macular degeneration. But if you're looking for Medicare to pick up your prescription reading glasses or your driving glasses, that they do not do. Same as cosmetic surgery, acupuncture, hearing aids, fittings for hearing aids. And we do have the Medicare.gov official website listed. You can go there and find other things, but those are the more common that people will ask about. Okay, so it sounds good, Daryl. I really don't have much of a choice. Medicare A and B, most people like it. How do I go ahead and set up? How do I enroll? Well, for some people, it's automatic. If you are set up to draw your Social Security benefit at age 65, the month you turn, you will be automatically enrolled and you'll receive a Welcome to Medicare package roughly 3 months before your birth month that you turn 65, or if you're on Social Security under age 65 due to disability, 3 months before your 25th month. But as most people are aware of nowadays, Social Security full benefit age is pushed back to 66 and even go up to 67. So many more people are delaying their delaying their Social Security benefits. So if you're not drawing Social Security, or if you're a Railroad Retirement Board eligible, Railroad Retirement Board benefits, you do have to sign yourself up. And you can do that, the easiest way is directly on the Social Security website. Now, Social Security and Medicare are two separate agencies, but Social Security handles the paperwork for enrolling you into Medicare. That's why we use their website. So here you can see we've got a little circle. If we're on Social Security website, ssa.gov, in the lower right-hand corner, it says Medicare Enrollment. And if you click on that tab, you'll see this window open up. And you'll eventually come to this spot here if you scroll down, where it allows you to apply for Medicare only online. Occasionally folks get a little anxious. They're like, well, I don't want to start my Social Security just yet, and they're a little leery of this. Keeping in mind, this says apply for Medicare only, and there are no forms to sign. It does not have anything to do with your Social Security benefits, and it works really slick. So if you have any issues with that, we're more than happy to help you out if you'd like. Okay, time windows. Medicare has gone to election periods, and we'll spend a little bit more time talking about that later on. But when you're new to Medicare and you need to sign yourself up, there's a time window. And if you look at this, the month that you turn 65, let's look at that as the center point. You have 3 months before the month you turn 65, the month of, and then another 3 months after that you can do the online application and not be subject to any late penalties or that type of thing. Your effective date is the month that you turn 65 if you sign up before. And up here it says delayed start in red. So if you wait till the month you turn 65, or if you wait for the 3 months after, you can still sign up and you're not subject to any premium penalties, but there is a delay in your Part B effective date that can be significant. So here we've taken a screen from the Medicare site, and it shows you that if you wait until 1 month after you turn 65, so let's just argue that you turned 65 in August, and you waited till September to fill out the paperwork. Well, your Medicare Part B wouldn't be effective until November and December. It's 2 months after the month you sign up. So work on that. And if you need help clarification, we're more than happy to take phone calls or emails after the presentation. Okay, so again, in other words, if you turn 65 in the month of June and you have to enroll yourself because you are not receiving Social Security benefits, and you enroll 1 month later in July, your effective date for Medicare coverage will be delayed 2 months after July, so August and September, meaning October 1. So that can be significant. Okay, everybody's favorite subject, Part B late penalties. I'm concerned about this. How do I avoid them? Well, your Part B late enrollment penalty is a charge to you if you do not sign up during that 7-month initial enrollment period that we just went over. You have 10% of your Part B premium is added to you for each full 12-month period that you could have had Part B but didn't. And typically the only time you can sign up for Part B is during the general enrollment period. And this is a time window that lasts from January 1st through March 31st of every year. So this is when you would do the paperwork. However, your Part B does not become effective the 1st of July. Now, the Part B late enrollment penalty does not apply if you delay your Part B because you had employer coverage through yours or your spouse's active employment. And we're going to talk a lot about that here in a little bit. So keep that in mind. So I'm going to show you an example of what a Part B late penalty might look like. We've picked up Mary here. She's a fictitious Medicare member. She did not sign up for Part B 2 full years after she turned 65. And here's the key. She did not have coverage somewhere else through hers or her spouse's active employment. So she'll be assessed a 10% penalty for each full 12-month period she delayed. The penalty is added to her Part B monthly premium, and in 2020 that premium is $144.60. So here's how the math works out. We start with the standard premium, and then 20% of $144.60 comes to $28.92. So we add that to the $144, which comes to $173.52. And the way Medicare and government programs work, they automatically round up to the next dime. So instead of paying $144.60, she'll pay $173.60. And that Part B late enrollment penalty never goes away. So you'll have that for life as Part B premiums increase, and typically they'll increase every year. That penalty percentage will go up because you're paying on a higher premium amount. Okay, so another thing that hurts about Medicare financially is IRMAAs. Now these don't apply to everyone, but we still want to talk about it. IRMAA stands for Income Related Monthly Adjustment Amount. And all IRMAAs are based upon the AGI, or your adjusted gross income, from your federal tax return 2 years ago. So IRMAAs in 2020 are based upon your tax return from 2018. You can appeal if you disagree or have a life-changing event. There's Form SSA 44 that you fill out, and then all IRMAAs are paid directly to CMS, the federal agency that manages Medicare. So let's take a closer look at what that actually means. Well, here's the chart, and this shows what your income-related adjustment is. So in 2020, the standard premium is $144.60 for either joint return under $170,000, individual under $180,000. But if you're 1 penny over, then your Part B premium goes to $202.40. And then you can see we've got a couple other different brackets here. And yes, in southern Johnson County and Kansas City, Jackson County, we've run across a handful that are actually at the highest bracket here for Part B premium. Now, it is a rolling 2-year look back, so it could eventually decrease or go away, but it is something that you may need to take into consideration, some folks. Okay. So I've got all that, but Daryl, everything that's been going on economic-wise and other things, I like to work, I need to work, I want to work. how does working beyond age 65 impact my Medicare timing decisions? Great question. Well, first of all, you're eligible for Medicare at age 65 even if you're not retired. And Part A does come at no premium for most people if you've had 10 quarters of working Medicare coverage. But if you take Part A, even though it's free, it could negate your ability to contribute tax-free money to a health savings account if you have one available to you where you work. And please don't confuse health savings accounts, HSAs, with the flexible spending accounts, FSAs. Those are two different. And working beyond age 65 may affect your Part B enrollment decision. It may be to your benefit to delay Part B also if you have employer coverage based upon you or your spouse's active employment. And I can't stress that hard enough. We'll beat that one into the ground. COBRA, retiree, continuation of benefits, all that type of thing. If your medical benefits do not come from yours or your spouse's active employment, chances are you need Part B. So here I've taken a screenshot from the Medicare and You booklet where it talks about this example here, that if you or your spouse is still working, it may be to your benefit to delay, and they're very specific that coverage based on current employment does not include COBRA. And we see a lot of folks that run into penalties and problems because they paid COBRA premiums and they're very expensive, and they decide they're not going to pay their Part B because they don't want to double coverage. Well, you still have to have Part B even if you're paying the COBRA premium because it's not based on active employment. Same thing with retiree coverage, VA. Here where it says individual health care through the marketplace, we're talking about an Obamacare policy. Okay, so Daryl, I have employer coverage. And I'm going to work till age 69, 70, as long as I feel like it. How do I choose? What should I do? Well, I've tried to make it a little simpler here with just some basic ideas. You may want to stay on that employer's coverage and not take your Part B, maybe take your Part A if you don't have a health savings account. You got to ask yourself these questions. Do I have a younger spouse? Do I have younger dependents that I want to maintain coverage on that group plan? Then I may have to continue that. Sometimes the cost and coverage for that employer plan could be less expensive and more comprehensive. It's not uncommon that we see employers picking up a very large portion of the employees to where it's cheaper to do that than to pay the $144.60 Part B premium. But an employee, a dependent, a spouse, they might be quite a bit more. And obviously personal preference goes into play. If you're going to decline the coverage, this is what I find. Do the math. It could be cheaper. I've talked to people who it was a dependent. It was costing them $500 a month to stay on a spouse's plan. And if they went off that, they'd pay $144.60 for Part B and maybe pick up a supplement and still not pay anywhere close to the $500. And you can always ask your employer, hey, if I'm eligible for Medicare, if I go off the group plan, is it possible, since I'm not costing you that money in benefits, that some of it could go into my pay? You never ask. Your answer will always be no. Okay, let me take a drink here for just a second. So I'll put together this grid, and this is actually in the Medicare and You booklet. It's on page 20 of the 2020 Medicare and You. And I realize it can be a little small on your screen, but it basically says that if you have retiree insurance, so insurance from a former employer not based upon active employment, Medicare pays first, and that retiree coverage is considered secondary. So in order for it to work correctly, you must enroll in both Parts A and B. Here it talks about you're 65 or older and you have group health plan coverage based on you or your spouse's current employment, and the employer has more than 20 employees. You can delay your enrollment into Part A and B because your group health insurance plan is the primary payer. If you're 65 or older, still working, however, this key is your employer has fewer than 20 employees. If it's less than 20 employees, then Medicare becomes primary. You must enroll in Part A and B, and it may be obviously to your benefit to not take the employer coverage if there's a cost to that. And the last one is on dependent children under age 65, where the primary payer is the group plan. Okay. Well, that's clear as mud, but what happens to me when my employment ends? I still want to make sure I don't end up with that Part B penalty. Well, once your employer coverage ends, you'll get a special enrollment period. And this is something that the time window the government provides to you, that you can sign up for both Part A if you delayed that, as well as your Part B without a penalty. And you can actually do that within 8 months of losing coverage based upon you or your spouse's active employment. Why 8 months? Because that's the way they wrote the law. Most people aren't going to delay it that long, but that's the time window. And again, COBRA or retiree coverage are not based upon active employment, and you would not get a SEP in that special enrollment period in that case. So if you don't get the SEP, then you're in the general enrollment period. You can only do your paperwork January 1 through March 30th, and it only takes effect July 1 of the following year. There is some legislation in Congress now actually to maybe loosen up some of those things, but that's how that works. So again, going back to the original title here, once you stopped working and you no longer have that employer group coverage, you can sign up for Part B without a penalty. There's a couple of forms that you fill out, the L564 and the CMS 40B, and you can actually do it online. We've got a video that we recorded that walks you through that process. We're more than happy to help you here in the office as well. Okay, so my Part D drug coverage. Part D is, again, offered by private insurance companies under contract to Medicare, and there are two ways that you can get your prescription coverage under Part D of Medicare. The first is with a standalone plan, and these are usually a companion to Original Medicare, your red, white, and blue Medicare card. Again, they're offered by private insurance companies, and here in the Kansas City Metro, we actually have a little over 28 different standalone plans available. So that's option one. Option two would be to get your Part D drugs built into a Medicare Advantage, which is sometimes referred to as Part C of Medicare. That's an all-in-one plan. We'll talk a little bit more about that in the future here. There are actually 32 different Part C options just in Johnson County, Kansas. So to be eligible for Part D, again, you do not have to be retired. You simply must have Medicare Part A and or Part B to join a standalone drug plan. To be eligible to join a Medicare Advantage plan that has Part D built in, then you must have both Parts A and B. So the drug plan only, it's one or the other. In an Advantage plan, you must have both A and B. And then you have to live in the plan's service area. For a Medicare Advantage plans, that could be county specific. For most Part D plans that are standalone, they're usually state specific. But you always have to pick a plan, and you always must enroll yourself. There's never anything automatic where Part D is considered. Now, this here, it's a little confusing, and we're going to paraphrase it, put it into different words. But this is out of the Medicare and You booklet, and this shows what do I get if I enroll in a standard Part D drug plan. Well, in the government design back in 2003 when the law was created, they had 4 stages to Medicare. You first start off by paying a monthly premium to the plan, and then your plan would have, number 1, a yearly deductible. Once you satisfy that, you would go to what they call a co-payment or co-insurance phase. And then should you use up that amount, you would go into the coverage gap or the donut hole, and that would be where people would have significantly higher cost. And then if you continue through the year, you would go into catastrophic stage 4. So in 2020, that initial deductible is $435. And everything with Medicare, it's good for you to think calendar year, January 1 through December 31st. So if your plan has the $435 deductible, it's charged to you from January 1 through the end of December. So even if you enrolled in a Part D plan on November 1, you would still have that $435 deductible for November and December, and then it starts again the following January 1. Okay? Some plans eliminate the deductible, but this is the minimum standard. After your deductible's met, then you go to the copayment or coinsurance phase, and this is where you might have a flat copay of $2 for a drug, $5 for a more expensive one, $45 for higher costs, so on and so forth. And you'll have that copay for as long as your combined amount of the cost, what you pay and what the plan pays, stays below $4,020. If your total cost goes above $4,020, then you go into the coverage gap. And it used to be in the coverage gap, you paid all the cost of your drugs. The laws have changed, and now as of 2020, you will pay 25% coinsurance, and the Part D plan picks up the other 75%. There's some discounts that are thrown in there. So you might see your copay, your coinsurance change when you go into the coverage gap, but you're still going to have coverage, and in some cases, your cost might actually go down. But if your total out-of-pocket spending reaches $6,350 for the year, then you go into what's called catastrophic phase, in which your costs go down dramatically. You'll pay a very small coinsurance, 5%, or a stated copay, whichever is higher. Now, if you're like most folks we talk to going through the technical stuff, you're scratching your head going, what? So let me put my Daryl rephrase. Once coverage starts under a Part D plan, you're given a checkbook by your drug plan. The checkbook has $4,020 in it, and you cannot put more money into your checkbook. So when you go to the pharmacy, the total cost of your drugs is deducted each time you fill your prescription, including deductible if your plan has one, and your copay, the fixed dollar amount, or your coinsurance fixed percentage. So, for example, let's say the total cost of your prescription is $100, and your plan that you have for Part D does not charge you a deductible. Even if your copay or your coinsurance amount is a flat $25 and the plan paid the other $75, the total cost of the drug, what you paid and what the plan paid, the $100, is subtracted from that $4,020 checkbook amount. So as long as you have an available balance in your checkbook, you pay the copay, your Part D plan pays the rest, everything is fine. So if you look at it from a calendar year standpoint, since there's $4,020 available for the calendar year, if you divide that by 12, it means that the total cost of your drugs every month would need to be over $335 for you to use your checkbook up before the calendar year runs out. So for many people, especially with the vast amount of generic drugs, low cost, this isn't an issue. If you're someone that is looking for Part D because you take insulin dependent, you're insulin dependent diabetic, chances are you will use up your checkbook before the calendar year is up. So should you use your available balance up mid-year when you enter the coverage gap? It used to be, as I mentioned, you paid 100%, but now by law, you're going to pay a flat 25%. So for my insulin dependent diabetics out there that are concerned about the high cost of that, and it can be typically $300, $400 without insurance, you'll still have coverage, but once you use up your checkbook, you'll see your coinsurance go to 25%. So if it was $300 for the insulin, you'd pay 25%, $75. The Part D would pay the other $225. So it's still a help. It just changes the dollar amounts. Now, the total cost of what you paid and 95% of the discount that's in there when you're in that coverage gap counts as out-of-pocket spending. Think of a bucket on the table here. And when you had money in your checkbook and you put a copay, that goes into the bucket. And when you go into the coverage gap, what you pay and 95% of that discount goes into that bucket. And if your bucket reaches $6,350, then you go into the catastrophic. We do run into it from time to time, but I think it is pretty challenging. But as you can see here, for someone who goes into catastrophic, they see their drug costs go down dramatically. And for those of you that hate the pharmacy commercials on TV, I know I'm not a big fan of them. A lot of those drugs that you see advertised that are high technology injectables, they're like $1,000, $2,000 a prescription. The unfortunate folks that need those will typically run into catastrophic coverage in their calendar year. Okay, enough of my commentary. A few things about Part D. In order to be a covered drug, it must be approved by the U.S. Food and Drug Administration. That includes your drugs, biological products, your supplies associated with injection of insulin, and the plans must cover a range of drugs in each category. So there's what I call therapeutic families. So you will always be able to find at least 2 drugs that cover any medical condition covered under Part D. But the coverage and the rules can vary by plan. The biggest thing that you want to look for in a Part D plan is the formulary, and this is just a fancy word for the drug list. If your drug is on the list on the formulary, then you're going to have the stated copayer and coinsurance. If your drug is not on the plan's formulary, then the plan does not have to pay. You can file an appeal, ask for an exception, but it's not guaranteed you're going to get that. And your formulary or your drug list can and does change annually. Sometimes drugs come off during the year, but that's only because they've been deemed unsafe and the FDA has ordered them to be removed. Typically what you'll see is at the end of the year in September before October 1st, your plan is required by law to send you what's called an ANOC, the Annual Notice of Change, and that will let you know what changes, if any, are happening in your plan in case you want to shop for something different. And typically what we'll see at drug plans is the drug is still on the formulary, but it might move from a lower tier to a medium tier, meaning that your cost, your copay, might go up. And if you don't look at it closely, you can sometimes miss that. Okay, there are some drugs that are not covered under Part D, and I've got a list up here. This is just the more common one. It's not all exclusive here. But drugs for anorexia, weight loss, the ED drugs are no longer covered. Cosmetic or lifestyle purposes, prescription vitamins, so sometimes we'll run across that with folks, as well as fertility drugs. Okay. So that's your Part D, again, trying to give you a good overview without getting too far deep in the weeds and that type of thing. But I do want to talk about Part D late penalties, because just like we had a penalty for joining Medicare Part B like boy late, you can have the same thing with Part D. It's calculated a little bit differently because the law was written at a different time. So again, when you turn 65 and you become eligible for Part A, if you do not have prescription drug coverage through active employment some other place, and you delay Part D because you just don't want to pay the premium, if you change your mind down the road, decide you wish to add, they add 1% of the base beneficiary premium for each month you were eligible and didn't enroll. And this goes on for as long as you have Medicare Part D drug coverage. That national base premium is set by CMS, the federal agency that manages Medicare, and in 2020 it's $32.74. This can and does change every year, but again, you are not charged a Part D drug late penalty if you had credible drug coverage or if you get extra help, which we'll talk about here in a minute. So what does credible drug coverage include? It means I had prescriptions through a former employer or union plan. I'm eligible for TRICARE due to my military service. Indian Health Services, veterans, so the guys and gals who are qualified for VA drug coverage, They would never have a Part D late penalty as long as they were eligible for VA. And then individual health insurance coverage as well. So if you delay your Part D drug because of those things and then you change your mind, you should not be assessed a Part D late penalty. Okay, so IRMAA pops up again. Just like if you had a high income and you paid a higher premium for Part B, you get the same thing for your Part D drug coverage. And here I put the chart. And again, you can find this on our helpful resources page on our website. But in 2020, if you're below 85,000 single, 170,000 as a joint tax return, you just pay your Part D plan premium. But if you're 1 penny above and so on, you can see it goes up. So YPP, where you see that, just says your plan's premium. So if you picked a Part D plan that was $15 a month, but you were in this second bracket, you'd pay $15 plus the $12.40. Okay. So we've talked about Part D drugs, we've talked about the IRMAAs for the high income folks, but I also mentioned something about extra help for lower income. Now, this is not an insurance program. This is a part of the federal Medicare program. You apply through either Social Security or you can call 1-800-MEDICARE. But it is designed to help folks with lower incomes pay their Medicare prescription drug cost. It's actually called Extra Help. If you were on the Social Security website, you'll see it there. Sometimes its technical name is called Low Income Subsidy or LIS, so they're both the same. And it means that if you have the lowest income and resources according to the scale, you might pay no premium for both Part B, your Part D. You might even waive your prescription drug copays down to a very small amount. Even if you have an income above that level, you might see your Part B or D premiums go away and you see a reduction in your prescription drug copay cost. And it will also eliminate that coverage gap and eliminate any late enrollment penalty if you have one and you qualify for extra help. Excuse me. Really dry throat this morning. Here is a chart showing the 2019 extra help income and resource limits. So basically, if you or someone you know and you're single and you're below $1,561 per month, you may very well qualify for extra help through the federal program. For a married couple, it's $2,114 per month. There can be some give and take based on family size. If you have someone else in your family living with you, they do take into consideration some financial resources as far as assets. Your home, your car doesn't count, but savings and investments do. And it costs you nothing. If you call 1-800-MEDICARE, they can take the application right over the phone. We're more than happy to help people here in the office, answer questions, and help you get the forms filled out to see if you qualify for this help. So while I'm on the same subject, sometimes people will confuse Medicare with Medicaid. Now, it's important to understand that Medicaid is something that you qualify for based upon income and family size. Age is not a qualification factor. So in most states, Medicaid provides health coverage for low-income people, families, children, pregnant women, the elderly, and people with disabilities. In some states, the program covers all low-income adults below a certain income level. So while Medicare and Medicaid sound the same, they are two distinctly different federal entitlement programs providing coverage to different populations. And while it is possible to qualify for Medicare and Medicaid at the same time, most beneficiaries do not. Excuse me. Okay, so now let's take a look at how all of your puzzle pieces fit together, and we're going to take a look at what the insurance companies offer that works with Medicare. Specifically, we're going to take a look at Medicare Advantage versus Medicare Supplement. So if you go to your Medicare and You in Section 1, it talks about 2 ways to obtain your Medicare coverage. So we're going to first take a look at option 1. This is where I stay enrolled in original Medicare Parts A and B, and I use my red, white, and blue Medicare card, and I pay my Part B premium to the government. Step 2 would be to decide, do I want a standalone Part D drug plan? I would pick a plan, fill out the paperwork, enroll, and I'll get a card, and I'll have a second premium for that Part D drug plan. Then I would decide, do I wish to add a Medicare supplement to help cover Medicare's deductibles, copays, and coinsurance? And if you do, you fill out the forms, get a card, and you'll have a new third premium for the Medicare supplement. So that's option 1. Option 2, which is totally different, would be to choose to enroll in a Medicare Advantage plan. Now, to be eligible, you must have Part A and B on your red, white, and blue Medicare card and always continue to pay your Part B premiums. But Medicare Advantage, while it is still Medicare, it is provided through private insurance companies that are under contract to the government. And it usually is one card that includes your doctor, your hospital, and your prescriptions under Part D. You may have a small additional premium. Some cases there may be no premium, and that throws people. And typically you'll be using a network of doctors or hospitals, commonly referred to as HMOs and PPOs, and we'll dive deeper into that here in just a moment. Okay. All right, so now we're going to focus on option 1. Excuse me, folks. My throat is really dry this morning. It must be allergies in the air. Okay, so basics of Medicare supplements. Sometimes the government booklets will call them Medigap plans. So if you see Medigap, it's the same thing as Medicare Supplement, just a different name. Your premiums typically increase with age. So the premium you pay at 65 or 67 will be lower than what it might be at age 70 or 75. All Medicare supplements by law are called guaranteed renewable, which simply means as long as you pay your premium, you cannot be canceled. You cannot have your rates increased any differently than anybody else with the exact same policy. And by law, all Medicare supplement plans are now what's called standardized. And we'll go through this here in just a moment. But a plan letter, a plan F, is a common example. All Medicare supplements will have a letter designation. And if you're looking at an F or a G from company X, Y, or Z, by law, they all have exactly the same coverage. And this was designed and intended to help people make it easier to price compare. No Medicare supplement includes drug coverage. So if you buy a Medicare supplement and you want Part D drug coverage, you'll have to pick a standalone Part D plan to work as a companion. Now, this chart here comes out of page 70 out of the 2020 Medicare and You. And as some understanding of what you're looking at, here in this first column, these are all of the deductibles, the leftovers that red, white, and blue Medicare Part A and B leave for you, the Medicare member, to pay. So your Part A coinsurance, your Part B coinsurance, that Part A hospice deductible, Part A deductible, B, so on and so forth. And then when the government standardized plans back in 2010, they said, actually 1992, but modernization in 2010, Plan A supplement will only cover these 4 things. B covers a few more, so on and so forth. Plan F was very popular for years. It paid 100% of everything Medicare left over. Now there are some restrictions on who can apply for that. Plan G is very popular nowadays because it picks up 100% of what Medicare leaves left over, with the exception of one thing, and that's that Part B deductible, which is currently $198. So your out-of-pocket is $198 plus your premium. It's a very popular plan. So whether you're looking at Medicare supplements from company X, Y, or Z, look at your plan letter designation. The benefits are exactly the same. It helps you to better price compare. So when you apply for your Medicare supplement, you cannot be turned down when you're applying within 6 months of first activating your Part B coverage of original Medicare. So even if you work till age 70 and you never had Part B until age 70 because you had employer coverage, and your Part B starts on the month that you turn 70 in 5 years, you'll still be able to apply for a Medicare supplement with no health questions for the next 6 months. Now, after your Part B has been in effect for more than 6 months, then you do have to answer health questions when you apply for a Medicare supplement. There can be some exceptions to that, but the carriers can use your answers to these questions to decline coverage or increase premiums. And sometimes I think I'm injecting an opinion here. It can be an issue, but sometimes people are scared into thinking that if they answer the health questions, they're going to get turned down, and that's just not the case. We help people get Medicare supplements when they answer health questions all the time. So anyway, okay. So how do Medicare supplements work? Well, there are no networks of doctors. There's no HMO supplement. There's no PPO supplement, that type of thing. As long as the doctor you're seeing will bill the red, white, and blue Medicare card, by law, that supplement has to pay, period. So whether you're a snowbird and you've got a home in Florida, Arizona, come back to Kansas City, what have you, if you've got a primary care provider in both states, Medicare supplements work just fine. You'll never need prior authorization to receive services from doctors or hospitals, CAT scans, MRI, and you never need referrals from a primary care doctor to see a specialist. And that's because red, white, and blue Medicare is the primary payer, and you never need a referral when you have Medicare A and B. Okay, so basically with your Medicare supplement, depending on the plan that you pick, it's going to cover all or most of the Medicare deductibles and coinsurances left behind, depending on the plan you select. But you do pay a large monthly premium for that convenience. It's sometimes referred to as a prepaid convenience. If you like to know what your budget is and not have extra expenses, supplements work very, very well. Now, Medicare supplements are one coverage per policy. So spouses would have their own separate policy. I used to call it per belly button. So if you're a husband and wife, you're going to have two supplements, one for you, one for your spouse. Okay, so that's a very high-level overview of Medicare supplements. Now let's take a little bit of a look at option 2, Medicare Advantage plan. How do they work? What do they look like? What do I need to know about them? Okay, well, first of all, this is a dramatically lower premium than if you were to do a Medigap or Medicare supplement. Now, the benefits and premiums can change every year, but you typically will have Part D drug coverage built into your Advantage. It is Medicare. You're just receiving all of your Medicare services through the private insurance company that is contracted with the government and has to follow government rules. In addition to your medical, in some cases in an Advantage plan, you may be able to pick up coverage for things not covered by red, white, and blue Medicare A and B, things like routine dental and vision, and we'll talk a little bit more about that. But you have to be willing to accept that you're going to have possibly restrictions on what providers, doctors, hospitals, labs that you can use, because your Advantage plan will have an HMO network, which is typically a small network, or possibly a PPO. The difference with Advantage plans also is that you'll pay a little bit as you go in the form of a copay or a coinsurance when you use the plan at network providers. So let's talk about those networks, because you need to understand a network should you choose to go to an Advantage plan. So your first type of network is an HMO. Now, HMO stands for Health Maintenance Organization, and typically you'll see the lowest out-of-pocket costs with a HMO Advantage plan. And again, they include the Part D drug coverage built into the one card. You'll have typically a smaller network of medical providers, so less choices in terms of family doctors, specialists, labs, hospitals, that type of thing. And if you use a non-network provider or a doctor or hospital that's not on the list, you'll pay all of the bill. You have no coverage for it unless it's an emergency and you're taken there because you had no choice. HMOs have no out-of-network coverage except in emergencies or urgent care when you're traveling, and we'll talk a little bit more about that. Now, in an HMO, you may be required to get prior authorization. In other words, your doctor may have to send in forms to the HMO Advantage plan to get approval first for you to have certain procedures. Maybe it's an MRI, maybe it's a type of surgery, that type of thing. In some HMOs, you can be required to get a referral or a permission slip, if you will, from your family doctor in order to see a specialist. And you could get, if you're willing to accept those things, you may find a lot of extra benefits, things like dental, routine cleanings, different things like that, coverage for your eyeglasses, a credit towards frames and lenses, and that type of thing. Sometimes you'll see extra benefits in the forms of gym memberships or over-the-counter items. There's a lot of different things that you may get if you're willing to accept the HMO Advantage plan. Okay. So that's the HMO, again, a smaller list, but there is another option in Medicare Advantage, which is called PPO. Now, PPO is what I call a moderate copay. You still have a limit on your copays, you have a limit on your out-of-pocket, and most PPOs include the Part D drug built in, but you'll have a much broader network, a much broader list of doctors and hospitals that you can pick from. And should you choose to use a doctor that's not on the list, in a PPO, you still have coverage, but your cost goes up. So they prefer you to use doctors on the list, but you can go outside, hence the name Preferred Provider Organization, or PPO. PPOs may also give you access to medical providers in other states or regions of the country, and some folks who are snowbirds that maintain dual residences, they may actually pick a PPO Advantage plan because they can have a doctor in Arizona and they can have a doctor in Kansas City and have all their routine care. So it's another option. Now with PPOs, again, you may be required to receive prior authorizations. Typically, you'll never need referral or a permission slip from your family doctor to see a specialist. And many people like PPOs because it is much less restrictive and you have a lot more freedom, and you still find the extra benefits sometimes. So here's a quick comparison. In an HMO, you're typically paying a smaller copay in exchange for a smaller network. You'll have to use your network or you pay it all unless it's an emergency. You find you may have less control and your network is typically limited to your local area. Whereas in a PPO, you're going to pay a slightly higher copay, but you have a larger network. You can go out of the network. You can move around. Your coverage may go with you when you go to another area for extended periods of times. So again, it's just another option with Medicare Advantage. Okay, so that's how the networks work. That's how the lists go. How do Medicare Advantage plans work in general? Well, again, this is part of the Medicare program. It's called Part C for a reason. So Medicare Advantage plans receive money every month from CMS, the federal agency that provides Medicare coverage. In return, these plans must follow all of Medicare's rules. So for billing purposes, if you join a Advantage plan, your Advantage plan card is your Medicare card. You don't actually show your red, white, and blue Medicare card when you're using an Advantage plan. You keep it safe, you keep it at home, because if you leave the Advantage plan, you may go back to presenting your red, white, and blue card. But while you're enrolled, if you choose that option, you always show your Advantage card as your Medicare card. Now, you can change Advantage plan companies every annual open enrollment period with no health questions or pre-existing conditions. So if you find you no longer like a plan, you can switch at least once a year. Justin, if you do me a favor, bring me a glass of water. My voice is just going to hell in a handbasket, as the saying goes this morning. Okay, so how do I qualify for Medicare Advantage? Well, number one, you must live in the plan's service area. And this will be laid out in their summary of benefits. It's usually county specific. And you must be enrolled in original red, white, and blue Medicare Parts A and pay your Part B premium as long as you're enrolled in that plan. There are no health questions associated with Medicare Advantage. Currently, you can only be denied coverage by law if you have, at the time of application, end-stage renal disease, which is permanent kidney failure requiring dialysis. You're waiting a kidney transplant. This restriction goes away starting January 2021. Okay, well, Daryl, that's all great, but how do I choose between option one, Medicare Supplement, or option two, Medicare Advantage? Well, I've tried to break it down a little bit here, and so we're going to kind of recap just a little bit how that works. If you go option one, Medicare Supplement, it's a prepaid convenience. You pay your monthly supplement plan premium, whether you receive care or not, but you know what your budget is. Okay? Typically, you'll have very little out of pocket medical costs besides your premium when you receive care. You don't have any list of doctors, there's no network restrictions. As long as that doctor will bill the red, white, and blue Medicare card, and most do, that supplement by law has to work. So if you're the person that is concerned about, well, what happens if I get something very serious and I want to go to Mayo Clinic, I want to go to MD Anderson, I want to go to any of these very advanced research hospitals, then that might be something where a Medicare supplement would suit you better. But you need to be aware that your premiums on Medicare Supplement can increase every year. It may not be quite every year, but it could be every 2 to 3 years. There's medical inflation cost as well as possibly because you get older. And this is important because Medicare Supplements by law can typically only pay after Medicare approves that medical service. So in the rare case, and it does happen from time to time, if Medicare denies that provider's service, the supplement can't pay by law because Medicare's rejected the claim. Okay, so I've taken a sample here and we've just kind of gone with a rough premium amount. If you're a little bit older, if you're in a different state, you might see a little different here, but this will give you a good general ballpark. If you were to do a Medicare supplement, and let's say you did the Plan G, where you pay the Part B deductible and it pays everything else, typically you'd be looking at a premium of around $125 a month. If I were to add a separate Part D drug plan, you can find a little bit cheaper, but I just left it at $20 a month to get a nice round figure. Again, just trying to help people picture in their mind how to choose between supplement or advantage. So if you take $145 a month times 12, that comes up with a yearly premium of $1,740. Okay, so if I go to the doctor enough, I might have to pay out of pocket $198. So my deductible plus my premium comes to $1,938. But after this Part B premium, that Plan G supplement and Medicare, 100% of my medical costs are covered. So some people like that. Now, your Part D drug copays are calculated separately, so I've left that out. And in this example, you would not have any benefits built into the supplement for dental, vision, or hearing if that's important to you. Okay? But you have no networks, no restrictions, no nothing. Many people love it. Okay, so how does that compare to Medicare Advantage? Well, with Medicare Advantage, this is more of a pay-as-you-go plan, okay? You can get zero premium Advantage plans, which means as long as you pay Part B to the government, they don't charge you anything extra. But your premium is your cost of the copay when you receive care, and I'll show you some examples here in a little bit. But there is a limit on how much your out-of-pocket cost can be. Now, the copays can change every calendar year. So just like Medicare supplement premiums might go up every year, the copays on an Advantage plan can change. It's no big secret that things do get more expensive as the years go on. And in an Advantage plan, you have to understand and accept how your network of doctors and hospitals work. All my doctors that I like are in there. The hospitals I like are in there. I like the extra benefits. I'm okay with it. Medicare Advantage is not a bad option. It's just a different option. Okay, So I'm going to get no premium. I'm going to get some extra benefits. Well, help me quantify it in a dollar amount. Okay. So just like I tried to give some rough estimates on what you might pay in terms of Medicare supplement premium, let's take a look at what you might expect with a Medicare Advantage. Typically, you'll have zero monthly premium, and you'll get Part D drugs built into that. And you might have a copay for doctor visits. So let's assume you saw your family doctor every month for a year. Well, 12 doctor visits, and assuming your plan had a $5 copay each time you visit, you might have $60 out of your pocket. And in that year, you saw a specialist. I tease people if the doctor's title ends in IST, so cardiologist, ophthalmologist, urologist, whoop-de-doologist, then that's the specialist copay. And typically, you'll see a $50 copay in that range on an Advantage plan. So if you saw 4 specialists, you'd have 4 $50 copays, another $200 in your bucket. They'll have a higher copay in an Advantage plan for hospitalization. No deductible typically, but you might have a copay, and here we just picked an average number. So most people don't get mad at me for saying a 3-day hospital stay could be normal, some cases shorter, but we picked that. So if your copay was $290 a day times 3, that's $870. Add it to your out-of-pocket limit. And if you have 2 trips to the emergency room in that year, once by ambulance, you could see your total yearly medical cost could range $1,620. Again, your copays are separate for Part D drug, and you might get extra things, extra coverage for dental, vision, or hearing. But this is a pay-as-you-go plan, so sometimes people will ask me, well, if I don't use this, and if I don't use this, and if I don't use the hospital, I'm not going to pay for it. Well, that's how Advantage plans work. So it's a matter of doing the math. Are you comfortable with the network? Are you willing to accept the copays and that type of thing? And knowing that you can change every year. They're not bad, they're just different. Okay, so we've talked a little bit of conceptually about how Medicare supplements and Medicare Advantage are different, but we need to talk too about enrollment periods because, as the saying goes, timing is everything. So we've talked a little bit about it earlier, but enrollment periods are limitations on when you can make changes to your Medicare Part D and Medicare Advantage. I like to call them time windows. This is the time window in which you can make a change with the government, fill out the forms if you want to make the change. If you don't make the change and the time window closes, then typically you're waiting another 12 months in order to make changes to your Medicare benefits. So let's look at the more common ones. I'm new. I love this one here. Most people, when you were a new employee at a company, they bombarded you with stuff, and one of them was your benefits package. Okay, you've got 30 days to decide if you want insurance, fill out the forms because you're new. Well, that's what happens when you turn 65. You're new to Medicare, and that's that 7-month window where your birth month is the center point, and you have 3 months before the month that you turn 65 and 3 months after that you can enroll either into Part B. If you enroll in Part B to add an Advantage plan, add a Part D drug plan, that type of thing. If you do nothing during your initial enrollment period and you didn't have other coverage, kind of like what we talked about earlier, then your time window closes and you'll have to wait for the annual or see if you qualify for a special enrollment period. Okay, so again, this is a chart showing you what that initial enrollment period, specifically talking more about Medicare Advantage and or Part D. You're new, so it's the month you turn 65, 3 months before, and again, 3 months after. Okay, well now I got here time for change. With all your Medicare Part C or D, you have the annual enrollment period. So just like an employee at work, if you have more than one insurance option, they may tell you once a year, if you want to switch from option A to option B, different premium, different coverage, you need to do your paperwork. Well, Medicare uses a similar philosophy. So for those of you that are new to Medicare, I think you're getting a lot of mail in your mailbox now. Wait till October, you're going to see a lot more, because the annual enrollment period starts October 15th through December 7th. You'll start getting mail as soon as October 1. And this is where all of the Medicare Part D drug plans or Medicare Advantage plans will tell you what their benefits will change to starting January 1 of the next year. It's a shopping period. So if you would like to change your Part D drug plan, maybe you've had a drug added that's not on your formulary and you've got it added mid-year. Maybe you've looked at your notice of change for your plan that you have, and the premium's gone up quite a bit, and you want to shop for something cheaper. Maybe you want to go from an Advantage plan to something different, all that type of thing. So during the annual enrollment period, you can do just about anything you want. It's kind of an open free-for-all. You fill out your paperwork from October 15th to December 7th. The change becomes effective the following January. If you like what you have, you don't have to do anything. It will automatically roll over to the next year. You don't have to do paperwork to stay in a plan that you have that you like. But once it gets to midnight on December 7th, that time window closes, and you cannot change your Part D or your Medicare Advantage plan until the next annual enrollment period 12 months later, unless maybe you qualify for a SEP or special enrollment period. Now, there is an exception to every rule, and for the golfers out there, I like to call it my mulligan here. I just shanked one into the woods. Can I try that again, and don't hold that stroke against me? Well, this is new. OEP, Open Enrollment Period. This is January 1 to March 31st, and it was just new this year. And it's really designed as a switch period. So it's only for people who are enrolled in a Medicare Advantage plan with prescription drug built in. So those people can change to a different plan, or they could leave their Advantage plan and return to original red, white, and blue Medicare and pick a standalone drug plan. The government built this in as a safety net. Sometimes people don't read their ANOC forms in the fall. They're bombarded with so much mail. They show up at their drugstore on January 2nd and find out then how their changes impact them because they didn't read it for whatever reason. So the government brought in the OEP as a relief valve if you find a change that you missed by accident, if you will. Okay, so it's very limited. And the good news is you're not bombarded with mail and advertising because there is no marketing by the companies allowed by law. And then lastly, we're going to talk a little bit about special enrollment periods. So what does this mean? Well, it means something special has happened to you that gives you the opportunity to either add a Part D or change your Advantage plan during the calendar year. And typically special enrollment periods last for 63 days after that special event has occurred. So these are some of the more common special enrollment periods where you had employer group coverage, and now I'm 72 and I'm losing that. I want to sign up for Part B without a penalty, add a drug plan, Advantage plan. Well, something special has happened to you now, so that's where you get that. Got a question here. Hang on just a moment. So JDM is asking, you got a lump sum from a pension. Does that affect your Medicare payments? Lump sum from a pension, if it drives you over the IRMAA amounts, it could. There is an appeal, that SSA 4. So the best thing to do would be we could talk to Medicare about that for you. If we look at that IRMAA chart again on our AMSKC page, Helpful Resources, we do have the listing and the breakdowns for IRMAAs. That would be about the only way I could think that that would impact you. Okay, so let's go back to the SEPs. Loss of credible drug coverage. I had VA coverage and I lost it. That would be a special enrollment period. I had a drug plan through my former company that I retired from, and they went bankrupt or they took it away from me. Sometimes we see that happen, unfortunately. That would be a special enrollment period example. Your drug plans are based upon the state that you live in. So if you started in Kansas City on the Kansas side and you moved across State Line Road into Kansas City, Missouri, your drug plan from Kansas is for Kansas residents. You'd have to pick a new plan based upon Missouri. So there's a lot of different things in there. There's a lot more special enrollment periods, but these are the more common ones. If you have questions, give us a call. We're more than happy to help, and we don't bite. Okay. So now I'd like to take and try to surmise some of the things that we've run through and see just exactly how this works and hopefully help you take away a little bit more learning from this. So we're going to look at some common scenarios. I'm going to ask you some questions and see if you can kind of walk yourself through it. So we've got Bob and Carol here. It's March 2nd. That's important on the calendar. Bob is 68 years old, so he's been a few years beyond 65. Now, he is retired, but he's had coverage from Carol, his wife's employment. So since he was age 65, he's been actively covered by her employment. He enrolled in Part A, but he didn't do Part B because he had Carol's coverage through her employer. But now he's going to lose that employer coverage on March 31st because Carol's finally reached age 65 and she said, I'm done working, I'm going to go on Medicare. Carol turns 65 in April and she plans to enroll in Medicare. So what do Bob and Carol need to do to make sure that their coverage has no interruption as far as medical? Well, first of all, Bob will need to enroll in Medicare Part B, and Carol will need to enroll in Parts A and B by March 31st in order to have coverage on April 1. Because typically with government programs, as long as your paperwork is in by the 30th or the 31st of the month, it can be effective the first day of the next month. Now, Social Security Office facilitates enrollment paperwork, and Bob will be asked to have Carol's employer fill out a separate form. It's called an L564 that just verifies, yes, Bob was covered under Carol's group employer's insurance plan, and that gives him the ability to add Part B during the year, no fuss, no late penalties, all that type of thing. So once Bob and Carol have applied for Part A and B, so they don't even have to have the card, they just have to have filled out their paperwork, then they could start shopping for a Part D drug plan coverage, make sure they find one that fits their needs and their budget, and they could choose to start looking for Medicare Supplement coverage. They could also choose to pick a Medicare Advantage plan with Part D drug coverage if there's an Advantage plan available in the counties that they live, because not all counties have Medicare Advantage. So that works pretty smoothly. Just fill out the forms, just know your time windows and do all the paperwork, and it'll go without a hitch. Okay, scenario number 2. Run into this sometimes. I call it Mary's Dilemma. Mary is 74 years old. She's a frugal girl. She takes very little medicine. She's got 2 generic high blood pressure pills, and she can get them at Costco for $4 a month, and she sees absolutely no reason to spend premium dollars on a Part D plan since her drug costs are so minimal. So she's never had drug coverage under Part D for the last 9 years. But now it's May, and she's just had some type of heart issue. And now her doctor is prescribing 2 brand name medicines that cost over $400 a month for her heart condition. Well, what happens to Mary? Well, since it's May, her next time window to enroll in a Part D plan is the annual period, October 15th through December 7th, and that paperwork becomes effective January 1. So she will have to pay 100% of the cost for her medicine, or she can apply and see if she can get manufacturer's assistance from the drug manufacturer. Those are usually based upon income. When she enrolls in a Part D plan, she will also be subject to a lifetime late enrollment penalty of 1% for each month that she was eligible for Part D, not enrolled, and didn't have credible coverage somewhere else. So what does that look like? Well, Since she was eligible for 9 years, there's 12 months in a year, she's got 108 months without coverage. So she's got a 100% percentage to calculate her late enrollment penalty, or LEP is the acronym. And since the benchmark is currently $32.74, we multiply that by 108%. So her late enrollment penalty is $35.36 per month. But remember, government rules, they round up to the next dime, always up. So her Part D drug late enrollment penalty is $35.40. So the end result of Mary's decision is that she cannot get Part D prescription coverage until the following January to be effective. She'd do the paperwork in the fall, but it doesn't become effective till January 1. She'll be paying 100% of the cost of her medicine for May, June, July, August, September, October, November, so on. And assuming that she does enroll in a Part D plan, she'll pay the plan's premium plus an additional $35.40 each month for the rest of your life. Now, we can spin this a couple different ways here. You could say she didn't pay any premium for 9 years, and maybe that works out over the penalty. Maybe, maybe not. But that's what you would be looking at, and you can make your own decisions. So now this one is the one that probably frustrates me the most because we run into this more often. I like to call this Dick's early retirement offer. We could throw Cobra on here. We could throw whatever we want. But here's the scenario. Dick is 63. He's a single guy, and he's worked for Acme Company pretty much his whole life, 40 years. And the company's downsizing. They've been merged. They've been acquired by somebody else. And all of a sudden, he's given this early retirement package. And in it includes, for every year you've worked for us, we're going to provide 1 month of group medical insurance for you. And Acme's a big company. Well, Dick does the math. He's been here 40 years. He's like going, geez, I'm going to take this offer and run because I can still go find another job somewhere else. And I'm going to have free company health insurance until I'm almost 67. Then I'll just sign up for Medicare and get me a supplement. Life will be beautiful. Well, Dick enrolls into Medicare Part A 2 years later when he turns 65 because there's no premium charged to him. But he declines Part B, his medical, because that's a premium charge and he doesn't want to pay. And he's, for the last 2 years, I've had no problems using the company insurance that I got as part of my early buyout package. And he's figuring, hey, I got another 18 months almost to go before it runs out, and I got to start spending my own money. So 6 months later, Dick sees a doctor, presents his new red, white, and blue Medicare card with just Part A on it, and his group insurance card to the doctor's billing office. Opens his mail 30 days later, and he gets a bill from the doctor saying Medicare has denied his bill, and so did his former employer's group plan. He's mad and he's confused. He doesn't understand what's happened. It's some type of conspiracy. Well, here's the rub. Page 18 of the 2020 Medicare NU, the official government guide to Medicare, states, if you or your spouse is still working, and if I haven't beat this into the ground enough, folks, I'm going to keep doing it, you have to have employer coverage based upon you or your spouse's active employment with that employer in order for you to delay your Part B of Medicare without running into a problem. So again, here is a screenshot from the Medicare NU that reminds you coverage based on current employment does not include COBRA, retiree coverage, which in this case, this is what this is considered. It's a continuation of benefits after he's separated employment. So it's a form of retiree coverage. So again, you or your spouse must be actively working in order to delay Part B enrollment while covered under that specific employer's group insurance. The fact that Dick was working for somebody else means nothing. Employers with 20 or more employees, their group insurance coverage is considered primary to Medicare. So the group plan pays first, then Medicare may or may not pick up. Retiree coverage, COBRA, or in this case, a continuation of benefits following an early retirement or layoff, while many times it's very good coverage, because it is not based upon active employment, requires Part B, and more importantly, under government rules, it pays secondary or after Medicare. So, since Dick did not have Medicare Part B, and that's where doctors' office visits are billed to, there's no primary insurance existing. And it's for this reason that his group health plan cannot pay, as they don't have anything to be secondary to. It automatically makes that group plan primary, and the rules don't allow. So by law, the secondary coverage can only pay after Medicare approves the claim. So again, I go back to this chart that we talked on earlier, and again, you will find this on page 20 of your 2020 Medicare and You booklet, that if you have retiree insurance from you or your spouse's former employer, Medicare pays first. You must enroll in and have Part A and B. So now the big rub is Dick is going to have to wait for the Medicare Part B general enrollment period, which is January 1st through March 31st, to fill out the forms to enroll. It won't take effect till January 1, and he's going to have a Part B late penalty of 10% added for each full 12-month year he delayed and didn't have coverage. Now, since his Part B coverage won't be effective till the following July, he also has no coverage for outpatient services, doctor, emergency room, labs, x-rays, MRIs, outpatient surgeries, you name it. This is one of the more frustrating things that we run into here. So if it seems like I'm being a little over the top with it, it's because you've never had to tell somebody in April who's asking to start their Part B because they have cancer that they're not going to be eligible for coverage for another 15, 16 months. I have unfortunately been in that situation. So forgive me for getting on my soapbox just a little bit. It is important as you approach Medicare age that you get competent guidance. And whether you talk to a local agent like ourselves, call 1-800-MEDICARE, Social Security office, go see your health, human resources person, benefits administrator, talk to somebody and not just Joe at the water cooler. So my favorite saying is the mind can only absorb what the butt can endure. I appreciate you all spending time with us here. We could talk a lot about Medicare. We can get really deep in the weeds if you want to. I would love to get your candid feedback. If you send us an email, shoot us a text, we're not going to bother you. We just like to get feedback so we can improve. We've actually added a few things to this presentation from last week based on some feedback we got. So again, leave us your comment. You can send us an email to our general inbox at info@amskc.com. We'll have the email in the description box on the video. The live recording will be posted to YouTube here shortly. So if you'd like to go back and review stuff, you'll find it available very shortly. Also, if you would, click the thumbs up button on our YouTube channel if you like the class. It helps us a little bit. You may want to consider subscribing to our channel to be notified on future videos. We do put out short topics, sometimes Medicare updates. And if you're like a lot of people, you may be unsure what your next step is. So if you'd like help enrolling into Medicare, making sure you avoid any mistakes, give us a call. We don't bite. We're happy to help you. And our services are provided to you at no charge. We can also help you compare cost and benefits for just about any Medicare supplement plan out there, regardless of company, as well as the Part D or Advantage plans. We're an independent agency, brokerage, some people call us. We actually have contracts with well over 42 different insurance companies, and we can get you all of the reputable names that you might know. Given here a screenshot, we do have an office very conveniently located just south of the Hy-Vee grocery store at 95th and Antioch. We're actually the second building directly behind the Hy-Vee gas station, directly off of Antioch. And again, we're an independent. We can do our things. We have software programs to help you see all the quotes, run one quote for you in one place, compare all the plans. We can break down different things for you besides just premium. We also invest a lot in computer technology. I'm a self-professed lover of gadgets, gadget guy here. If you don't want to come into the office, we can do over-the-phone meetings. We use programs similar to Zoom. We can actually do a lot of cases, all the applications electronically. You can stay at home. We can do it here in the office. But more importantly, you'll have us here as your servicing agent locally. So once vaccines are found and we can have some safety going out and about, when you have a problem, it's nice to know you can call us and take care of it rather than 1-800 dial 1 for this, 2 for that, 3 to throw your phone out the window. But I mentioned before that our services are at no cost to you, and I always like to break that down. What does that mean? Because you can't get something for nothing, right? Well, if you choose to use our services and you enroll in a plan through us, we receive a commission from that plan that you choose. Now, by federal law, all your Part D or Advantage plan commissions are standardized, so whether you pick brand X, Y, or Z, it's all the same to us. We don't care. Zig Ziglar had many sayings, but the one I like best is, you'll get all you want in life if you help enough other people get what they want. We make our living helping people navigate the Medicare maze, pick plans, but we provide annual service, annual reviews. We'll help you walk through your ANOCs, let you know if there's some big change, or let you know, no big deal, just throw it away, enjoy your Thanksgiving and Christmas. So we'd be honored to help you, and again, it won't cost you anything. We're paid directly by the companies. So that's all I've got. Again, thank you for joining. We always look forward to your feedback. And if you do have comments, leave them in the comment box below. If you like the video, give us a thumbs up. Also, if you've got a particular topic that you'd like us to make a video about, leave us a comment in that section below. I'm trying to put out one video a month, or excuse me, a week, on a shorter subject, maybe 5 to 10 minutes on a specific subject. So if you got something you'd like us to do, let me know. Again, I'm Daryl. I'm the agent. I'm a director of training here at AMS. Thanks for stopping by, folks. Enjoy your Saturday. Good day.